Thank you so much, Christoph. I'm pleasure to be here, and got to say I'm very excited to be part of this session. A lot of different points of view on some topics that I'm very interested in, and the first one is about remote patient monitoring, which I believe is going to be extremely important going forward for healthcare just worldwide. Um, and so the first presentation is going to be about objective remote monitoring of shortness of breath in COPD patients. And Rob Hagmeijer is the presenter. He's with AMES BV. He's an associate professor and founder and CEO, so multiple hats. Looking forward to this. Rob, take it away.
Thank you very much, Alfred. Ladies and gentlemen, welcome to this talk. So I'm going to speak about chronic obstructive pulmonary disease, which is abbreviated to COPD. And COPD is a lung condition that is often triggered by long time smoking. And the symptoms are chronic bronchitis and emphysema, and I will explain later on what that exactly is. Well, more than 50 million people suffer from this disease in Europe and USA, and altogether the total healthcare costs of COPD in EU and USA are about $70 billion each year. So to deal with this situation, remote monitoring becomes really desired to say reduce the load of hospitals. So it's not only desired, actually, it's also necessary, and for that reason, it's also quite booming at the moment. So what exactly are we talking about? If you consider the lungs as a number of tubes and a number of alveolar sacs, very small little sacs, then the tubes, if they are getting inflamed, we call that bronchitis. So that's always on the lure in COPD patients. And the other thing is emphysema, where the alveolar sacs that actually are responsible for the interchange of oxygen and CO2, they collapse, they degenerate and inflammate. So this is the condition of a COPD patient. So you can imagine that breathing is quite difficult. Now, the key problem that we address here is the harmful and costly exacerbations that COPD patients suffer from. So an exacerbation is a medical term for acute worsening of symptoms, almost always triggered by viruses and bacteria. So if somebody with a normal lung gets a cold, a COPD patient would develop an exacerbation. And there are several levels of seriousness of these exacerbations: mild, moderate, severe. And once you end up having a severe exacerbation, you have the risk of being hospitalized, and that will take about 7 days on average. Now, in the EU and USA, yearly 2 million of these hospitalizations take place. And that's just to rescue patients from this potentially life-threatening situation. Now, the key point in this picture is in the middle. You can see my cursor, where it says that if you detect a moderate exacerbation in time, you can prevent hospitalization by giving the patient prednisone and or antibiotics. So doctors claim that about 90% of the hospitalizations can be prevented in this way. So this is a really important message. How to detect these exacerbations? Well, in the GOLD 2024 guidelines, GOLD means Global Initiative on Obstructive Lung Diseases, it says, well, we have these 5 signals: shortness of breath, respiration rate, heart rate, saturation of oxygen in the blood, and the reaction of the immune system in the blood. And these are the signals